What can someone in chronic pain expect when they see an Adhesion Release Methods provider who does everything right, who follows our systems, and does lots of hands-on training, and someone who is just dipping their toe, telling people that they do Adhesion Release Methods, but doesn't follow the systems and doesn't do any hands-on training? I'm gonna play an audio message that someone sent us on Instagram, having seen two different providers. One provider who is doing the former and another provider who's doing the latter, in order to show you why following the systems and the protocols the way that they're taught and doing hands-on training matters.
Hey Chris, really good to hear from you. The whole experience with was amazing. Just a really good feeling. I mean, she's a complete professional. She's obviously totally serious about ARM. There's a lot going on with me. The initial exam was pretty, I'd say, brutal, just having heard about all of the stuff that's potentially wrong with me, but said, don't worry, she can fix me, and I totally trust her. I'm totally confident that she can. A totally different experience to what I went through with, I mean, just in terms of the exam and grading the adhesions, and just the way she changed strategies depending on what the goals were just over the 3 days. It was just a really great experience. It's obviously a pity that she's a couple of hours away, and the challenge for me is going to be how I get down there, because I can't have my sister driving me down there. But yeah, all good. I did want to say something about and obviously I don't want to badmouth him. He's a really good guy. I mean, I guess I can say we kind of became friends over the couple of months that I was seeing him. But what I've realized now is that if you really want to get good at ARM, you really kind of have to dedicate yourself to it and not throw away everything else that you're doing, but kind of, I guess, focus a lot on ARM and just getting good at it. So I hope that he agrees to do more training with you, because I think ARM is just, I think it's going to be huge. I think that it's going to fix me, and I want to get to the point where I can say, you know what, you've actually saved my life. So I really hope that he comes down and trains more with you, and kind of takes more of a focus, or puts more of a focus on ARM. Just want to, I don't know if you're going to be able to relay a message just to let her know that I do feel a big difference from the treatments. It's hard to tell exactly how much, because I know there's a lot of inflammation from the shockwave that she did on Friday, and just generally the treatments, heavy treatments over a 3-day period. I'm on fewer painkillers for sure than I was, before I went down to North Tonawanda, and I'm hoping it's just going to improve from here, but I know it's a long road. I'm adamant and looking forward to seeing her again. I hope your training goes well with her. Please give her my best, and I'm sending you my best wishes as well, and we'll keep you updated on how things go. Till we speak again, take care, have a good rest of your weekend, and thanks again for getting back to me. Cheers.
This was a lovely gentleman who's been talking to me over Instagram over the past few weeks or so, and I love speaking with all the people in chronic pain. across the United States, across the world, about the care they're getting, especially when they're seeing adhesion release methods providers, because that's what inspires me to continue getting this methodology out there. And this gentleman, he can't even drive himself to see this provider he's seeing. His sister has to drive him because he can't even sit in the car or chair. This was 2 or 3 weeks ago, and he's getting even more relief. He just messaged me this morning and saying he can't believe that he's doing much better. Sometimes I get tired of hearing myself talk. The thing that got me to the skill level that I'm currently at is doing tons and tons of hands-on training with my old mentor, Dr. Brady of Integrative Diagnosis, and my new mentors, Dr. Matt and Dr. Brandon at Precision Health Group in St. Louis. And I do 6 trainings a year, and I will not do any less than that, because if I go about 2 months without seeing them to just sharpen what I'm feeling in my hands, I start getting really frustrated and down on myself, and I feel like I'm not doing a good job in delivering the care that we give to our patients. And I've been doing this, the consistent training, since 2015, and it's been 9 years of consistent training, and then I also did training from 2009 to 2012, and I just won't stop. You couldn't pay me to stop training with them, because I am focused on being the best doctor, therapist, or provider I can be. And this is the type of care that people in chronic pain deserve, is a doctor who is not settling for anything less than their absolute best. And that's what Adhesion Release Methods requires of our providers. Since this happened with this individual who you just heard speak this audio message, we now have a minimum standard of doing at least 1 hands-on training per year to be on our www.findanadhesionprovider.com map. That's the minimum standard. I'm also incentivizing people to do more trainings with us by giving them cheaper and cheaper options with training, with accessing me and our program coordinator, Dr. Matt Maggio, with accessing all of our online material. It's a much more efficient investment when they train more. So I want you, as people suffering in chronic pain, to know that we're holding a very high standard for being an adhesion release methods provider, and I want to continue to uphold that standard as more doctors and therapists tell me that they want to be the best pain doctor or therapist they can be. Because my goal by the time I'm 69 years old, I'm 39 now, so 30 years from now, is that we have 5,000 competent and successful providers doing adhesion release methods across the world. And these are people that follow our systems, they do all of our range of motion testing, they do the history and the diagnosing the way that we recommend that they do it. If they're a massage therapist, they can't diagnose, but you can still communicate what you think is going on. They are following our test, treat, retest protocols. They're probably only using adhesion release methods tools, which is our hands, the grip bar, or the radial shockwave, because we haven't found any other type of adjustment or fancy other machine or gimmick to get people permanent pain relief. Just like you heard that gentleman say, you would wish that the person who wasn't doing adhesion release methods that he dropped those other tools. That's probably what is best for our providers to do. So this is for our providers. I hope that this gentleman inspired you to follow the systems the way that we teach it, to follow the protocols, to do hands-on training. And also for you suffering in chronic pain, we want you, when you think of going to an adhesion release methods provider, to know that you're in really good hands, to know that they're following our teachings the way that we teach them, and that you can trust the brand that is Adhesion Release Methods. And obviously there are going to be new practitioners, there are going to be intermediate practitioners, there are going to be advanced practitioners. You got to hang in there with me for that, because that's just the nature of any learning curve when you're trying to get better and to master something. So I hope that this was inspiring on many levels to people. We're holding the high standard for adhesion release methods. So hang in there. We're getting more providers out there. And I promise to continue to make this the premium choice for non-surgical pain relief across the world until the day I die. One more thing. I know that I've run the risk of upsetting the provider who this patient left to see the other provider. And this isn't meant to throw anybody under the bus. It's not meant to upset that person. It's not meant to say that they're doing anything wrong, but it is meant to nudge any provider who says they're doing this and isn't following the whole adhesion release method system to want to follow it so that we're actually serving our patients and getting them better. So I felt the need to record this tiny little video because that person is a great person. They're a great provider of healthcare. They're just not an adhesion release methods provider, and that's why I made the video. But the person's still a good person and they're worthy of love. If you'd like to see more about how we fix chronic pain at Barefoot Rehab in New Jersey and with adhesion release methods across the world, hit the like, hit the subscribe, and stay tuned for more videos that we will be releasing each week.